Welcome to Science with Soul. I'm Dr. Lottie Valentine and the host of this program. I'm a physician, evidential psychic medium, international keynote speaker, and the author of Med School After Menopause, The Journey of My Soul. This podcast was inspired by events from my own life, and as I have journeyed through life, it has taught me that we're part of a greater divine web of interconnectedness. I have walked the path of illness, healing, and transformation, and after experiencing 2 near-death experiences, I became clairvoyant, clairaudient, and clairsentient, and I was guided to attend medical school at the age of 54. In this podcast, we will meet many different types of doctors, healers, spiritual leaders, educators, and other interesting souls. And it is my hope that you will gain information from this podcast to help create a path of healing your own life physically, emotionally, and spiritually, and bridge the gap between science and soul. Welcome to Dr. Lottie's Science with Soul. I'm Dr. Lottie and the host of this podcast. Today, I am very excited to have Jenneh Rishe here to talk about endometriosis and adenomyosis. These are conditions that are poorly understood by most of our medical community. And as a result, it is therefore often misdiagnosed and mistreated due to the fact that most physicians just lack a deeper knowledge about these diseases. Jenneh Rishe has been a registered nurse for 12 years, working in many different specialty areas such as internal medicine, trauma, kidney transplant, oncology, and leukemia bone marrow transplant. It took over 4 years, but Jenneh's medical background gave her the knowledge and skills to navigate how to finally get good care after she was diagnosed with endometriosis. With her love for healthcare and education and teaching, she felt inspired to use her skills to help other women gain a better understanding of the disease. One way she does this is by contributing endometriosis content and working as a medical reviewer for Healthline. She's currently enrolled in a master's program to complete her Master's of Science in Nursing Education. Jenneh is originally from New Jersey, but has lived in Los Angeles for the last 9 years. In her free time, she loves running, writing, and spending time with her incredibly supportive husband, family, and friends. When asked why she felt so passionately about starting the Endometriosis Coalition, she says, "Endometriosis is criminally under-researched and horribly misunderstood. And I want to be part of changing that sooner rather than later." I'm so excited you're here today to share your knowledge with the listeners. Welcome, Jenneh.
Thank you so much for having me. I'm so excited to be here and to talk about endometriosis.
Oh, I am so excited you're going to be here and sharing all your knowledge because it is really a disease that's very misunderstood. And a lot of people don't even understand what endometriosis is. They really have a misconception of what that disease is. And I know you've had a long, crazy journey about this. Can you share about how did you find out that you have endometriosis? Like, how old were you? What symptoms did you have? What did the doctor tell you? And how was it diagnosed? What was the journey like for you?
Yeah, well, it wasn't a straight line journey, to say the least. I am considered one of the lucky women in that my time from symptom onset to actual diagnosis was 4 years. And to me, that was very long, but in learning more about the disease and hearing that for a lot of others, it takes close to a decade, I realize I got diagnosed on the earlier side. So how it started for me was at the age of 27, I started noticing this very intense, sharp, stabbing, take your breath away type of pain in the right upper side of my stomach. And the very first time it happened is like etched into my brain forever. I was driving on the 405 freeway in California on my way to UCLA. I was working as a nurse in their bone marrow transplant unit at the time. And I was sitting in traffic and this pain just hit me out of nowhere. And I remember thinking, do I pull over or do I try to make it to work? Like, what do I do? So I'm trying to just breathe through it, thinking maybe this is just kind of like maybe some kind of gas pain or whatever. So I'm breathing through it, trying to get myself to work, because I'm like, if I need to get anywhere, it's UCLA. So just trying to get so I get to work and it's easing up a little bit, but it's still very noticeable. And I walk in and I'm, planning to start my shift, and my manager walks in and she takes one look at me and she goes, "What's wrong?" And I'm thinking I'm hiding it very well, but apparently I wasn't. And I said, I don't know. I have this pain that just keeps coming and going, but I'll be fine. Like, I'm sure it'll go away. And she was like, "Absolutely not. You're not working this way." And called the emergency response team that comes to the unit when a staff member needs medical care. And I remember being so embarrassed. It was this whole to-do, them coming up and putting me on the stretcher and taking me to the ER and being kind of fawned over because I had my UCLA scrubs on, and just being kind of mortified over the whole thing.
Right.
Because in my head, I'm like, if this is just something really minor, but like, this is kind of embarrassing. So we get to the ER and, being that the pain was in my stomach, we were looking at everything related to kind of GI, my gallbladder, my liver, all of that. So we ran CT scans and we drew labs and everything came back normal and everything was fine. From that perspective, they gave me some pain medication and observed me for a few hours. And then basically told me to follow up with my primary care doctor and sent me on my way. So this pain kind of came and went for the next 3 days or so. So I stayed off of work until I felt, significantly better. And then it went away. And then I didn't really think much about it again. And then the next month it happened again. And then the next month it came again. And then the next month it came again.
Did this happen like when you had your cycle, or was it just out of the blue?
So I started realizing that at about the 4th month of having this cyclical stabbing right side pain that it was coming about 3 to 4 days before my period. And I thought that was strange because, one, just the location of it, I'm like, that's really odd, but it was like clockwork. I knew my period was coming because this pain would come right before it. So I brought it up to my gynecologist at the time. And I happened to be seeing her because I had just gotten off of the birth control pill, and I was planning to transition to an IUD. So I had already had an appointment to see her to insert the IUD, and at that appointment, I just happened to mention, "Hey, I've been having, this strange pain that comes before my period, and this is where it is, and it lingers for about 3 days into my period, and then it goes away." And she said, "I don't really see how that area could be related to your period." So I said, "Okay," and kind of just, went on my way about it. In my mind, I addressed it with my doctor, and she didn't.
Yeah, and where in your stomach was it?
Yeah, it was my right upper side of my stomach. So the right upper quadrant, so right underneath my ribs on the right.
Okay, so it's pretty high up. So
Yeah.
she was thinking that it's not the ovaries or, okay.
Exactly. So in her mind, it wasn't, menstrual cycle related. And so same thing that everyone was telling me, just keep an eye on it. So I had the IUD put in, and this pain just came and went for months and months and months. It just kept coming, and I just kept kind of dealing with it because everyone just kept telling me, we ran the test set of things that it could be, and everything looks good. So I just lived that way for about a year of that pain coming and going. And incidentally, at the year mark where I had to check my IUD to make sure it was still in the right place and didn't migrate anywhere, I was seeing a different gynecologist at this time. And leading up to that appointment, I would say about 4 months up to it, I started noticing some other things that were not quite right with me. Like I was having pain with sex specifically, and that was new. That had never been an issue for me before. And it was concerning enough that when she, did my intake and did my history and asked me, very pointed questions about the pain that I said I was having, about the pain with sex, she said to me, "Have you ever heard of endometriosis?" And I said, "Nope, never heard of that. What is that?" And she kind of explains it. "Oh, well, it's just this," and gives me this explanation that makes it sound like it's something as minor as the flu. Just said, this is what it is, and this is what we do for it, and we put you on birth control. And at the time, I already had the IUD,
Mm-hmm.
But her thinking, I guess, was that since the IUD is a more local type of birth control and not supposed to be as systemic, that maybe I would benefit and get some pain relief from having, complete stopping of ovulation with the birth control pill. So I agreed to that, and that was that. Set me on my way. I remember leaving the doctor, calling my mom and saying, oh, hey, that weird pain that I was having, the doctor thinks it might be endometriosis and this is what she's going to do. And I honestly just kind of went on with my life, not really thinking much of it because of how minor she made it seem. I didn't, it didn't seem anything that concerning to me. So we did the trial of one birth control pill, didn't help. Next 6 months, we tried another birth control pill. That wouldn't help. And then as this is happening, I'm starting to feel worse. So that right upper quadrant pain that was only, a few days before my period was becoming longer. It was showing up earlier and it was lingering around longer. So I would be in this pain for about a week and a half. And then as time goes on, it's 2 weeks. And all through this, we're trialing and starting and stopping different birth controls. And like I said, I'm not feeling any better from any of them. And we did this for about a year of starting and stopping birth control. At this point, the pain is pretty much every day now. So over the course of a year, it went from, just being cyclical to being every single day. And like I said, it was this gnawing pain in the right side of my stomach. And as it got worse, I would feel like I needed to always take a deep breath, but something wasn't allowing me to do it. My breathing started to feel constricted. So I had a primary care physician who was just very thorough. And after this year of all this birth control, it was time for me to have my yearly physical with him. And he's going over all my medications. And we bring up the fact that I'm taking a lot of ibuprofen. And that piqued his interest. And he was like, well, how much are you taking? And I said, usually like 600 to 800 a day. And he was just like, that's a lot of ibuprofen to be taking every day. So, I'm working as a nurse, so I can't take any type of like narcotic pain medications, before my shift. So it was basically, I would just, pre-medicate with ibuprofen throughout my day. And then when I got home, take care of my pain in the best way that I could when I would get home. And so he was the first person, and I found this really interesting, him not being a gynecologist, where he said to me, we don't even know for certain that you have endometriosis. We think you might based on your symptoms, but if this is something else, we really need to know that. And so he was the first one to suggest that I should probably have a diagnostic surgery to find out if I actually had it or not. And so looking back and realizing, that I agreed to medical treatment without even having an official diagnosis is the first place that I wish that I had known a little more, going into this, that I should have got diagnosed first.
Right.
I agreed to medical treatment. But like I said, the way that the doctor just said it so assuredly, like she just knew this is what it is and this will take care of it and kind of send me on my way. So my primary care physician referred me to a different gynecologist. So this is gynecologist number 3 now at this point. And this gynecologist was the first one that brought up the idea of diaphragmatic endometriosis. So he believed that I very likely had it on my diaphragm based on my symptoms. So now at this point, I have the right upper quadrant pain. I'm short of breath sometimes around my period. I have that feeling like I can't take deep breaths. I'm starting to have pain in my neck, in my back, in the front of my chest. So as time's going on, just all these strange things, are building up. I'm becoming more constipated where it's a problem. So he agreed that it was time to do a diagnostic laparoscopy. And so this is almost 2 years now in from the very first time I had symptoms. And so he sent me to a gynecologic oncologist to do my surgery. He felt that from a skill perspective, that this surgeon that he worked with was the most skillful to remove, endometriosis if I had any. And so I remember going to that consult, and coincidentally, it actually happened to be a surgeon that I worked with, because he was an oncology surgeon and I was the nurse manager over the oncology outpatient center. So I would see some of his patients. So it was like it was a very intimate relationship.
Right.
With care. So he said to me, I just want to let you know the risks and benefits of this surgery, the chance that we might not find anything at all, and that this very well is something that if we do find something, that you may need a surgery every year to keep going back in and basically getting rid of the endometriosis yearly. And I thought that was such a strange thing to, one, be preparing me for possibly not finding anything. And I remember thinking, is that a way of saying that this could all be in my head? I just remember it feeling so strange to like warn someone that we might not see anything at all. So I had that diagnostic surgery, and I was woken up from anesthesia, and he told me, I didn't see anything. Everything looked good from my perspective. There were some, he explained them as hypervascular areas, which were areas that were like a little more red looking, that I took some biopsies of just to be safe, but I didn't see anything obvious. And I just remember being devastated hearing that.
Yeah.
Because as far as I knew, for the last 2 years, I had endometriosis, and that was why I had pain. So then I'm spinning into, well, if it's not that, then what is it? And then what do I do? And on and on and on. So then 2 days later, he calls me and he goes, well, you know what? Your pathology report came back, and one of the specimens that I sent on your diaphragm came back positive for endometriosis. And I was so confused because I said, well, I thought you had said that everything looked great and you didn't see anything. And he's like, oh, well, there were some spots that looked a little funky, and I went ahead and burned those off and sent some specimens to pathology. So then this is the first time I'm hearing that I had what was called ablation surgery. I wasn't told that post-op, but after it was found that my pathology was positive, then I was told that I actually had ablation, which was so confusing to me. So then from there, my gynecologist decided, okay, we have our official diagnosis, so let's put you on Lupron. And this is another one of those places in my journey where I wish that I had known more about the disease before I agreed to doing this. So as an oncology nurse, I gave Lupron all the time to prostate cancer patients. So I was very familiar with the drug and in that world and how it was used for prostate cancer, and not knowing that its FDA approval for endo was kind of questionable. I had no idea at the time. So I agreed to it. And the plan was for me to do a 6-month course of it. And I lasted about 3 months on it because the side effects were just so unbearable. I was having hot flashes, really heavy bleeding. I'd wake up to like pool of blood. It looked like a horror movie. It was terrifying. Just my mood and I almost felt outside of myself. My temper was so short, and I'm not an angry or a feisty person by any nature. I'm usually very calm, and the smallest things would trigger me. Like I said, I was managing a team at the time, so you can imagine that's not a very great disposition to have, when you're trying to manage people. And I wasn't feeling any better. Ultimately, I felt worse, if I could be honest. And so that was kind of the climax of the getting a diagnosis to the first start of like actually treating the disease, which started a whole other journey after that, which we can get into if you want to go straight into that. But I'll let you lead with the questions.
Yeah. So how did you find an excision surgeon? How long did it take you to get there?
Yeah. So once I didn't do very well on the Lupron, I was sent to yet another gynecologist. So I think we're on number 4 now at this point. So the Lupron wasn't helping. My gynecologist he just didn't know what to do with me at that point, and said, we have a pelvic pain specialist here. I really want you to see her to see if she has any insight. So I go and see this pelvic pain specialist, and she actually doubts whether I even have endometriosis at all. So she says, your biopsy, it was just one. And so was it real? Do you really even have it? And if Lupron's not helping, I'm kind of doubtful whether you even have the disease or not. And didn't really leave me with any option from there. It was just, I don't trust your pathology report. You should be getting better, but you're not. And I don't really know what to tell you. So it was, again, another just dead end. So at that point, again, I'm getting worse. So now just walking around my apartment, I'm short of breath. I'm having a hard time just like making it through my workday. And again, luckily I end up in the hands of another really great PCP. So I was seeing an intern, like a first-year doctor. And so his rotation was over and it was time for him to go off into wherever else he was going to practice. And so then he had to assign me to a new intern. And so on my first time meeting her, just happened to be at the same time where that gynecologist told me she didn't know what was wrong with me. And I was kind of at this dead end thinking, now what do I do? So I get this new PCP who again starts from the beginning because this is my first interaction with her. And I think back, she's still my PCP now. And I'm thinking when I walked in that door, I'm like, oh, she had no idea what she was about to get herself. Right. Having me as a patient.
Yeah.
So she's going over my history. We're talking about the pain and the shortness of breath and the chest pain and all these things. And so her mind is going to, well, I know you had this biopsy and it confirmed this, but these drugs aren't working. Like, let's just be sure that this isn't cardiac related or pulmonology related. Like, let's be really diligent and thorough with this. So then we start down this rabbit hole of seeing every and any specialist under the sun. So I'm seeing pulmonologists, I'm having breathing function tests done, I'm seeing cardiologists, I'm having echocardiograms and CT scans and cardiac MRIs and just all of these things to try to figure out why I was having such a hard time breathing and why it was so painful. And at this point, I had quite a team around me trying to help figure it out. I think my case was interesting to them at this point.
Right.
I very much felt believed throughout the whole time. Everyone believed that something was wrong, but nobody knew. Nobody could put their finger on what. And I don't think anyone wanted to believe that endometriosis could make somebody as sick as I was. And in the back of my mind, the whole time I'm thinking, we know that I have this disease in my diaphragm. Like, obviously that's what it is. But I really believe that this idea that it's so rare, just, I think everyone wanted it to be something else. That's my perception. So every road we're going down keeps coming up, no answers, no answers, no answers. And this was about 6 months of all different kinds of cardiac and pulmonology testing. And then I get to the end of that road and they all just say, we don't know what to tell you or what to do with you. And it was at that point that I started doing research on my own about endometriosis. So this is well into my journey with, I would say, almost 10 different specialists, a world-renowned healthcare system, is when I finally started to actually teach myself about the disease. And I start looking into diaphragmatic endometriosis, and every single symptom that I have and every single thing I'm saying that I feel is textbook for what is saying that it is. And that's when I started looking for very specialized care, because I realized, oh, this isn't something that just anyone is going to know what to do about it.
It's such a good lesson for the listeners, for anybody that is experiencing any kind of pain like this and being told just like you, oh, it's nothing, it's this. And you had all these specialists at one of the top hospitals in the United States and researchers, and they still couldn't quite put their finger on it.
Yeah.
So then what happened? How did you finally get to finding a surgeon?
Yeah. So as I started kind of trying to find more research, I ordered a book by a specialist named Dr. Andrew Cook. And he had in the back of the book a list of resources for endometriosis patients. And one of them listed was Nancy's Nook on Facebook. So I joined this group, and it was a group basically for people who have endometriosis or think they might have it. So basically a learning resource center full of evidence-based research articles. And the best part about it at the time was that I had the opportunity to speak to other people who had similar symptoms as me, because up to this point, I had never met anyone who ever even had endometriosis, let alone had it in their chest cavity. So when I joined this group, for probably about 2 months, I just read so many posts, just reading other people's experiences and what they did and who they went to see. And I was seeing that pretty much every single person that complained about my type of symptoms all went to the same doctor, Dr. Ken Sinervo at the Center for Endometriosis Care in Atlanta. So I messaged a couple of the people that had posted just to get their personal experience, asked them how they were feeling, how they were doing pre-surgery and post-surgery, and it became very clear to me that this is where I needed to go to get care. And the Center for Endometriosis Care actually offers a free medical records review to review your records and give you their recommendation over the phone, what they think based on your surgical photos and all of that. Problem was, I didn't have any surgical photos. My surgeon didn't take any pictures. My surgical report didn't even mention that he did ablation. So what he told me on the phone wasn't documented anywhere. So I knew sending them records wasn't going to be helpful at all. So I decided to fly out there for an initial consult. And I went in there prepared to like convince these people to help me. At this point, I had to stop working. When we started the whole, pulmonology, cardiology journey, I was so sick that I couldn't work anymore. So I was on disability throughout all of that time. And so I chose to fly to Atlanta for my initial consult because I felt like I was going to need to convince them to help me, because that had been my experience up to that point. And I remember getting there and just sharing my symptoms and just feeling finally for the first time like I was speaking to someone that knew more about the disease than I did and didn't question a single thing and said, we see a lot of patients that have the symptoms that you have, is the thoracic symptoms that you have, and we've done a lot of these surgeries. And having my pelvic exam there was when I learned that I had other conditions, that they suspected I had adenomyosis, that they suspected I had pelvic floor dysfunction. And this is the first time I'm hearing any of this. And I've had so many pelvic exams in my lifetime, and they were always really painful to me. But I always thought that was normal because that's just what I do. And no one told me it wasn't. And, I would react and I would cry after them, and no one ever paid any attention to that. So in my mind, it was like, well, this is just an uncomfortable thing for me, and this is probably normal. And I learned at that visit that there was nothing normal about my response to my pelvic exam. So after that consult, I decided to go ahead and have surgery there. And that was in 2016, we made a surgery date for. So about 2 years from when my symptoms started to actually having my excision surgery.
Wow. And what did they find?
Endometriosis everywhere. It was, so since I had it suspected in my diaphragm, their approach is to have the surgery be a joint surgery with a cardiothoracic surgeon that they work very, very closely with. Because in order to visualize the entire diaphragm, the front and the back of it, you have to collapse the lung so that you can see it. And that's not something an OBGYN can do or should not be doing.
Right. Let's hope not.
Let's hope not, yeah. So it was a joint surgery where they did the pelvic half and then they did the top half. And so they found a pretty thick amount of endometriosis on the right side of my diaphragm, as they expected. It thankfully wasn't full thickness all the way to the back. I had it on my colon. I had it on my uteral sacral ligaments, on my abdominal wall, on my bladder, just everywhere. And what was really interesting was when I went over my surgical photos with my surgeon, a lot of the same places that first surgeon took biopsies from ended up being places where I had endometriosis found at my excision surgery. And I said to my surgeon, that's so strange that no other biopsy came back positive. And he said, when you have somebody that doesn't know what they're looking for, they're just blindly picking at spots, hoping that they find something. He said, you very well had what would have been very obvious to me as endometriosis, but since this surgeon doesn't do this type of surgery often, he doesn't know all the different appearances, that it can be white or pink or black. I think their top textbook is that it's just this very dark appearance, and that's what endometriosis looks like. So he said, you very well had early signs of it that he just completely missed. And he said, you didn't not have it in those places. He just didn't pick from the right spot for your biopsies. And I was just blown away by that, at the idea that if I didn't luckily have that one specimen that came back positive on my diaphragm, I would have been told everything's fine, you don't have endo, and I would have never even pursued, Nancy's Nook or the endometriosis care. I would have completely dropped that diagnosis out of my mind, if I had not had that positive biopsy. And so I get really, really upset when I have women come to me and say, I had my diagnostic laparoscopy and they didn't find anything. And I'm always like, that doesn't mean anything.
Right.
Because if it wasn't with a specialist, it doesn't mean anything that they didn't find anything.
Yeah, if you have symptoms, you most likely have endometriosis in there somewhere.
Right.
Right. And I hear stories like this all the time and how it's missed. And the patients, but what are the patients supposed to do? They see they were taken care of by a surgeon or an OBGYN and they can't find anything wrong. And now these poor women think that it's just all in their head, or they're making it up, or they're put on antidepressants as if there's something mentally wrong with them.
Right.
Right. Instead of knowing how to pursue it and get the correct help that they need.
Exactly.
So you were saying that they also found adenomyosis. Can you tell the listeners what the differences of endometriosis and adenomyosis? And I think a lot of listeners also think that endometriosis is something that happens inside the uterus, but as you were telling, it was all over. It was on your diaphragm. It's in the pelvic cavity. It grows in the colon. It grows like, it's almost like a cancer in a way that it's not a cancer, because it just grows on its own all over inside your abdomen.
Right. So endometriosis, by definition, just the word itself means outside of the uterus. So it's not...
but people think it's inside.
Right. And that's what most definitions from a lot of reputable sources will still say that it is, that it's the lining of the uterus and other places of the body. And that's conflicting. It doesn't make sense.
Yeah, because people think it's like a menstrual problem, that is just something inside the uterus, and they have no idea that this thing grows outside and it's taking over your whole abdomen.
Absolutely. So endometriosis is when tissue that's similar to the lining of the uterus, the endometrial tissue, it's endometrial-like, it's not exactly the same, ends up in places outside of the uterus. So like for me, on my diaphragm. Adenomyosis is when the tissue that lines the uterus actually invades the wall of the uterus. So the way I think of it is endo is outside of the uterus, adeno is inside of the uterus. And the main difference between the two is that endometriosis does not have a cure, but adenomyosis does, which is hysterectomy. You can actually get rid of the entire disease since it is found only in the uterus by removing the uterus from the body. And that's where the conflict, I think, is for a lot of people, is that they're told to have a hysterectomy for their endometriosis, which doesn't make any sense if endometriosis is outside of the uterus.
Right. And I think that's a misunderstanding that is very widespread. People think, because they think that endometriosis is just like it can be cured by the hysterectomy, when in actuality, it might not have anything to do with the actual uterus. You know what I'm saying? It's growing everywhere else.
Right. And if those lesions are just left there, then removing the uterus is not going to take care of that. So taking out my uterus, but leaving the disease on my diaphragm wasn't going to do any good. Yeah.
Yeah. So I know you also experienced all these heart problems. Was that related to the endometriosis, or was that something separate that you also had to take care of?
That was something completely separate, which also made things kind of confusing because the heart symptoms were similar to like the diaphragm issues. So we actually found out in pursuing my diaphragm endometriosis that I was born with two very specific and different congenital heart diseases. And we went down this rabbit hole of trying to decide if those are what were causing my chest pain and shortness of breath all the time, or if it was the endometriosis. And same kind of thing, I went through so many tests, and that didn't really point us to a yes or no. And so at that time I decided, well, I'm in so much pain that I'm going to follow the endometriosis route and see what happens from there. If I get better, then I know that it's not my heart. My heart's not the issue. And so, like I said, pain was the main thing to me at that point. I needed to figure out where that was coming from. And of course, the shortness of breath was a problem, obviously. But the pain for me was the worst part. And so when I had my excision surgery, I felt significantly better as far as that right upper quadrant pain, like all of that completely went away. I had no more pain.
Mm-hmm.
outside of the adenomyosis related pain that I later had a hysterectomy for. But from the excision standpoint and where I had endo, I didn't have any more issues after that. But I still had some lingering, not shortness of breath the way that it was when I had it on my diaphragm. I felt like I could take full deep breaths again. I just noticed my activity tolerance just wasn't as great as it was before. And I just figured, okay, I'm still healing from this surgery. And then as time went on, I realized, okay, I'm healed from this surgery and I'm still having kind of some issues. But what's interesting is I now know that my diaphragm being affected made my heart have to work harder and aggravated the symptoms that I did have with my heart and made it progress a lot faster than it would have had I not had endometriosis on my diaphragm, because those systems work together. Your pulmonary system and your heart all work in conjunction. And so me having this extra hurdle to get through to get air into my lungs made my heart work harder and sped up that process, which I guess is a blessing and a curse. I'm not really sure because the heart issues that I was diagnosed with oftentimes go undiagnosed, and the first sign of it is at a heart attack at a young age, or sudden cardiac death during activity. And I almost say that like my diaphragm endo was like this silver lining to helping me find this heart issue, or I may not have ever known that I had this inside of me. So much as I hated that journey, it did reveal something that I think saved my life at the end of the day.
Yeah. And did you have to have surgery for the heart too?
I did. I ended up having open heart surgery last year, November. I'm coming up on my 1 year to correct both of those issues. And I'm pretty good now. I have some residual issues just from having those undiagnosed heart disease for so long. My heart still has time needs to heal, but I don't have any more shortness of breath or any of those strange things that were happening before the surgery. So I feel like I'm finally
on the mend.
My medical mystery. Yeah.
That's quite a journey.
Yeah.
Wow. So after you had the excision surgery, how long did it take you to recover from that?
Yeah. So I was at the time of that surgery, I would say that the longest part to recover from was the thoracic part of the surgery, because they go through your chest muscle and that whole thing needs to heal before you're even allowed to like lift your arms or lift weights or drive a car. So that was about, I want to say about 8 weeks of having restrictions in that sense. And then started the like actual healing, I like to say, of pelvic floor physical therapy and just upper body therapy, because I'd lost so much muscle strength and coordination in my upper body, and learning that the pelvic floor and the diaphragm actually work in conjunction with each other. So I had this diaphragm that didn't relax correctly and didn't expand correctly, and then I had this pelvic floor that was dysfunctional, and they were both just like working against each other. And so I had to really learn how to breathe correctly again. I had no idea how to do that. It sounds so crazy to say, but I had no idea how to take belly breaths because it had hurt so bad to do that. So I just stopped doing it. And I just would take very shallow, guarded breaths. And I would sit in this very funny way to protect myself from pain. And so I was all misaligned in my upper body. And so I spent about a year in physical therapy, just working from head to toe, how to basically like function without these pain generators in my body anymore. So immediate recovery was about 8 weeks. But like I said, that full really paying attention to all the different muscles that were dysfunctional, it was about a year.
Yeah. It takes a long time. I'm glad you're doing better now there, but it's a long journey to recover from something like that. Would you say, do you feel healed now, or is it still like it's like a chronic thing that you have to deal with the rest of your life? Or
so that's a great question. So from a pain perspective, I don't have any pain at all anymore. And I'm going on 4 years after my excision. And then I had my hysterectomy for adenomyosis a year following my excision surgery. So I got better for about 6 months, where I felt great in every way. And then slowly I started feeling the signs of the adenomyosis a little bit more. So that was a very different type of pain where I was having like this pressure type of low back pain in my hips and in my groin where they just felt like heavy and like somebody was like trying to pull something through my pelvic floor.
You're right.
And so it became very clear that the adenomyosis was a bigger issue than it had been a year prior at my excision surgery. So I decided to have a hysterectomy for that. And that year, and I think back on it now, I actually just had physical therapy yesterday, and my physical therapist was like, I can't believe how far you've come. So the year leading up to my hysterectomy, my muscles in my pelvic floor had gotten so dysfunctional that like the simple exercises that they would give me, like standing on one foot, I couldn't even do that. I couldn't even balance on one foot because my glute muscles and my hip muscles were so deep. They was just a mess from trying to support my uterus. And then after my hysterectomy, once I got back into physical therapy, I could actually see progress. I was never progressing. Like I would keep going and we'd keep having to work on the same things. And I would get so frustrated, like, why isn't this working? And it wasn't until I got rid of my uterus that actually started to help. And so I still go to physical therapy because my hips still have a hard time kind of staying in place as to where they're supposed to be. And I have to do like glute stabilizing exercises regularly to keep things activated and functioning correctly. And I go to PT probably about once a month, sometimes twice a month, where I actually have to like get my lower half adjusted because it becomes uneven. And this is all byproduct of those years of having my uterus pulling things out of alignment. My muscles still aren't 100% set back to the way that they're supposed to be.
Right.
I don't know if it'll be something that I'll deal with my whole life because this is 3 years post hysterectomy now. I still have issues with it, but it's not in the way that it impacts my life where I can't do anything. So I still can cycle, I run, I hike. I can tell when I'm at the point that I need to go back to physical therapy because one of my legs ends up longer than the other one, and I can feel it. And I go to PT and he pops me back in place, and then I'm good to go. I'm hoping that as time goes on, that muscle memory will keep things in place and the strength will keep things in place. But the verdict is still out on that. And then additionally, I ended up with some GI issues from the scar tissue from surgery. That has been an ongoing thing and probably likely will be an ongoing thing. So, you know, any surgery puts you at risk for adhesions or scar tissue, and especially one within the pelvic and abdominal area. So I have some scar tissue that causes issues with my digestion. And the only fix to removing scar tissue is to have another surgery to remove the scar tissue. So it's, you know, and a whole other rabbit hole. So I just have to be very mindful about my diet and, you know, take specific medications to help my bowels to keep moving forward on their own. So those are, you know, that's a thing that was very much a byproduct of the endometriosis that I will likely live with for, you know, for my whole life. So these are these things where, you know, when someone asks me if I'm healed, I'm 100% better than I ever was before the surgery. But I'm going to have things that will, you know, will always remind me that that's a very big part of my life, you know.
Yeah. So for the listeners that are listening to this and thinking, oh, wow, maybe I have endometriosis or adenomyosis, what advice would you give to these people? And they might have been, you know, to the gynecologist and they say, oh, there's nothing wrong with you and just take a birth control pill. Like, where do they start? How do they go about trying to figure out if they have it or not?
Yeah, that's a great question. I think that the best advice I was ever given was by a nurse that worked at my primary care office who also had endometriosis. And every time I would come in, she would just feel so sorry for me and how badly I was doing. And one specific time she said to me, you know, a lot of doctors are going to say that they're specialists in this disease and they're not. And she said, so you really need to learn the difference between who actually is a specialist and who is not one. And that stuck with me forever. And that's really
great advice.
Yeah. And that's
great
really,
advice.
Right. And that's really what it comes down to with this disease is the doctor that you see makes the world of difference in how your care ends up, what direction it goes in. And I know for some people, and I get this a lot where they're like, well, I'm not in that much pain, so I'll just see my OBGYN for now. Or I don't really want to go straight to a specialist if I'm not even sure if I have it. And I try to explain that, no, this is when you should be seeing the specialist.
Right.
Right?
This is the time
This is the
before
time.
it goes really bad.
This is
Yeah.
absolutely the time that you want to make sure you're in the hands of someone who knows how to actually treat this disease the right way, who knows what the disease actually is, who believes in excision surgery and not ablation surgery, which is just burning the top of the disease off, which is ablation, versus cutting all of the disease out of your body so that nothing's left behind, which is excision. That those early stages of choosing what doctor you pursue, what surgeon you see, is so important.
Mm-hmm. And I know you started the Endometriosis Coalition. What led you to start that?
Yeah. So I was shocked at how little I knew about endometriosis as a healthcare provider myself. And I don't recall ever learning about this disease in nursing school. If it was brought up, it was probably like one page in my mother baby class, and we kept it moving. I like to say that I'm one of those learners that even if I don't remember everything about a topic, I always at least remember something. And the fact that the word didn't even register with me when my very first OBGYN brought it up to me made it clear to me that enough attention was not paid to it in nursing school, and just how little my nursing colleagues knew about it. And I realized that, the amount of time it took me from symptom onset to diagnosis was in large part because I knew how to navigate the medical system. I knew how to stop pursuing one path if I felt like it was a dead end. And I knew that doctors don't get everything right because I work with them every day. I knew that, one person saying no to something doesn't mean it's an absolute no. I know how to research. I knew all of this was innate in me, and I still had that much trouble getting a diagnosis. So how much more difficult for someone who doesn't speak the lingo, has no idea where to even start. And I really thought about, okay, what were the most difficult things for me? And hands down, it was finding correct information. Everything that I Googled was wrong. Every single thing that I Googled about it was wrong. And I really wanted to just create a space that you could come to, that you knew you could trust the information, whether it's being outsourced from other places that we trust, or we're putting the information out ourselves. And the main goal really is to raise awareness about the disease amongst the general public, who still has almost no understanding of it at all, and healthcare practitioners who also don't really have a very good understanding about it. And then the second part is making sure that we're promoting reliable and accurate information and education. And so that's really sourcing the information that we share and making sure that's coming from credible places, and just making sure that there's a lot of factual content about endometriosis being circulated. And I started the EndoCo with someone that I actually met online who had the same issues in getting diagnosed with me and felt the same way, like, okay, what can we do about this? And it was, to us, a no-brainer. Like, we have access to social media. It's really easy to share information. Like, let's just create a space where people can come to that they know that they can trust the information that they're getting. And that was kind of how it all started.
Wow, that's awesome. So how can people follow you on social media and learn more about endometriosis and adenomyosis?
Yeah, so you could follow the EndoCo at theendo.co on Instagram. And then our website is, if you just Google the Endometriosis Coalition, you'll get our website that has some basic information about the disease and resources as well. And then my personal journey, where I share just a little more in depth about pretty much all of my healing, is at lifeabove_illness.
Oh, love it. So those are some great resources for all the listeners to start learning about endometriosis. And endometriosis is very common and is so often misdiagnosed. So if you have any kind of weird symptoms or painful menstruation, or whatever it is, that go and learn from Jenneh's platform, Endometriosis Coalition. It's has fantastic information all over that is just invaluable to people. And I know I send my own patients to your platform because it is a fantastic resource. And like Jenneh spoke about, you go to reputable organizations online, and you might actually not get the latest information. Very few online platforms have the correct information, because the doctors are still learning about this, and it's not that many doctors that are aware of what that disease is actually about and all the different kind of symptoms that it can cause. Because people tend to just think it's a menstrual problem and here's some birth control pill, and they sort of write it off like that. So go check out her platform and learn everything about it. And I want to thank you, Jenneh, for joining us today and sharing your knowledge about endometriosis and adenomyosis. It's been a great pleasure to have you on the show.
Absolutely. Thank you for having me. I really enjoyed our time together.
Thank you so much. I hope you enjoyed listening to this episode of Dr. Lottie, Science with Soul. Make sure you are subscribed so you will be notified of new episodes as they become available. To book a session with me, or to sign up for a workshop, or to see me as a physician, please visit drlottie.com or divinespiritualessence.com. My book, Med School After Menopause, The Journey of My Soul, is available online at Amazon as well as other online platforms worldwide.